Hi, my name is Millie. I'm a student PT here at UAMS. Today I'm just here to take that dressing off, clean your wound for you, assess it, and then we'll get you a fresh dressing back on, okay? Before we get going, can you tell me if you have any pain in the wound or outside anywhere? Okay, can you rate that on a scale of 0 to 10? 0 being no pain at all and 10 being the most pain you've ever felt? Okay, it's about a 4, good to know. Alright, well, I will go ahead and get my area prepped so we can get you taken care of. I'll wipe this down all over, along all sides. Alright, throw this in the trash. Bottle. All sides, the top and the bottom. Also gonna clean my pin. Sides, top and bottom. And once that's done, I'm gonna go ahead and move the laundry and trash bins over. Good, and then we'll go ahead and wash my hands. Now that my hands are clean, we're gonna go ahead and get the area prepped. So we're gonna use this towel as our clean space. Right here, go ahead and move these things over, as well as all of our materials that we're gonna need for today. Okay. Get our dirty side set up. Set our used materials on. Okay, now that that's done, I'm gonna go ahead and put on my PPE. Start with our gown. On. Well, that's good. We'll go ahead and get you prepped. So I'm going to have you roll over to your left side. Slide this towel under you. All right, give you one more roll. Thank you, great job. And then this will be the towel that we use to cover you up, keep you covered. All right. Now all that's ready, we'll go ahead and get that wound tip looked at. So I'm gonna go ahead and take the dressing off. So the secondary dressing has no exudate and no odor. It's going to go in the trash. And then the primary dressing has minimal exudate and no odor. Let me get this cleaned out for you. Spray in the wound and around the wound. So go to the dirty side. Use this to clean down in there. Undermining and tunneling cleaned out. Okay. Good on that one. And then we'll use this to clean around the wound. Alright, so we got the wound all cleaned out. I'm gonna go ahead and take my gloves off. We're gonna get the tape ready. Dirty side, and I'm gonna go ahead and sanitize my hands again and put some fresh gloves on. All right, so now we got that going. We're gonna take some measurements and assess that wound a little bit. So, assessing length from 12 o'clock to 6 o'clock. It is 4.9 centimeters long. The widest part of the wound is from 4 o'clock to 9 o'clock, which is 4.4 centimeters long. I utilize a Q-tip to assess the depth. Okay. Depth is 0.9 centimeters long. And then there's some tunneling at 4 o'clock, which we'll assess the depth of, which is 0.8 centimeters deep. And then there's undermining, looks like from 6 o'clock to 9 o'clock. And the deepest part of that looks like 0.6 centimeters, okay? So got that done. I'm gonna go ahead and put these in the trash. Now we're gonna assess the wound bed, which are the tissue types. So we have 65% red granulation, about 15% dry eschar, I would say 15% of subcutaneous tissue, and then 5% of slough. The wound edge is unattached at from 6 o'clock to 9 o'clock, and then the peri wound is unremarkable. So now that we got that assessed, we'll go ahead and get it ready. So I'm gonna go ahead and clean the peri wound. Okay, got that all done. And then we'll go ahead and put that primary dressing in. Make sure that we pack that tunneling. Pack that undermining area. Need another one. The rest of the wound bed. Looks like that primary dressing is level with the skin, so I'm gonna throw this away and we'll go ahead and put that secondary dressing on. There. Go ahead and get that tape down. Now that we got that all done, Carly, do you mind telling me the time?
It is 2:58.
Okay, and it's March 1st, 2025, 2:58 p.m. Okay, so I'm gonna put this marker over here. All right, we'll get those towels off for you. Those in the laundry. Do a big roll over toward me. Good. Roll over tilt the other way. Nice. All right, so what we did today was took off the dressing that was on before. I cleaned the wound for you, assessed it, and then put a new dressing on for you. To ensure that we are promoting the best environment for wound healing, I want to make sure that we implement a turning schedule. So I want you to turn every 2 hours and make sure that you're staying off the wound completely, right? The last thing I want to make sure that we're doing is consulting a dietitian or a nutritionist to ensure that we're getting the best diet possible to promote healthy wound healing. Okay, go ahead and let me know what your pain is on that same scale of 0 to 10. It's at the same, about a 4. Okay, do you have any other questions for me today? Nope. Okay, well, we'll get my stuff cleaned up and get out of your hair, okay? I don't have any other dirty things I need to throw away, so I'll go ahead and take off my PPE. Harley, can you go ahead and untie my gown for me?
There you go.
Okay, thank you. Let me go ahead and take this off. Alright, I'm gonna go ahead and take my gloves off. Glasses off. Make sure those are clean. I'm gonna go ahead and sanitize my hands. Now that my hands are clean, we'll get these clean materials back over here to our clean area. All right. Go ahead and put this in the laundry. I'm gonna grab another paper towel to clean off the desk. Grab all the edges again. Throw this away, spray bottle back. Go ahead and move the trash can in the laundry bin back over here.